Williams at the Animal Emergency Center in Rabin. I have a border collie here that presented to the emergency center with an episode of, I think it was just a bit of lethargy. Yeah, and they did an ultrasound, found a mass in the abdomen. Everything was pretty normal. The only thing that was, I need the cautery plugged in, please. The only thing that was abnormal was the lactate was a little bit elevated. And so we've done a CT scan today, which confirmed the presence of a splenic mass. And is that on Blend 2? Yep, that should be it. And with no evidence of any metastasis. It's not clear what kind of tumor it is in the spleen. Differential diagnoses would be either benign, something like a hematoma, or a myelolipoma or something like that, versus something malignant like a hemangiosarcoma. Can I get cautery turned up to 40, please? But we might need to moisten the ground plate a little bit more as well. Okay. And so anyway, so we did the CT scan, confirmed no evidence of secondary spread. So we've gone to surgery, and we are going to take out this spleen. Now I'm using a new, I think it's on that side. We're using a new LigaSure unit that I'm actually testing for a company which is substantially cheaper than a Covidian unit. And we're just working out the algorithm and stuff like that to make sure that it works before I recommend it to people. So much, much cheaper. The other nice thing about it is that it has electric cautery as well, and so the electric cautery is what I'm using right now, and it seems to be working really well. I've had no issues with the electric cautery. The vessel sealing, or LigaSure, part of it was a little bit slow, and so we're working on, so it took about 10 seconds to seal a vessel rather than 4 seconds that I'm used to doing, but we are working on the algorithm right now to make sure that we balance speed of cautery with completeness of the seal. If you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you get a ding in your phone next time we live stream. So we are doing an abdominal exploratory here, and just note that I've gone all the way up to the xiphoid there. I'm going all the way down to the prepuce to make sure that I've got good exposure. I'm trying to stay on the linea, which I've succeeded in doing. Brian is sectioning away the fumes because there is some look, there's no evidence of an increased risk of cancer amongst surgeons who use electric cautery, but the electric cautery smoke does include some pretty nasty stuff. So I'm very happy to use suction in order to try to suck up at least some of that smoke. So I'm coming up to my xiphoid here. I just want to make sure that I don't go through my diaphragm. The way that you do that is just to make sure that you stay ventral to the xiphoid. And then I always remove the falciform fat because that's going to increase my visibility. And when I use the LigaSure, so when I do these with hand ties or suture, I ligate the large vessels and then go and ligate the splenic artery and vein separately, double ligature on the splenic artery. When I use LigaSure, I just ligate right along the lesser curvature of the spleen. So here's our LigaSure unit. The handpieces look absolutely identical to Covidian handpieces. It's alarming there for some reason. I'll try unplugging it, plugging it back in. It does seem like it's working. So this one does take a little bit longer than a Covidian, but again, we are working on the algorithm to try to speed that up. But it's like 15% of the cost of a Covidian unit.
Is it the whole thing with the machine as well?
Yeah. So Covidian unit is about $40,000 Australian, and this is going to be probably about $7,000,
okay.
something like that.
Yeah, that's a very big difference.
Yeah. Okay, can I get our Balfour retractors, please? Just watch that handpiece there. And it does, again, it does have an electric artery unit built in as well, which is really nice. So again, when we're doing our X-laps, we want to do a nice long incision. We want to remove our falciform. We're going to do Balfour retractors, and then we're going to make sure that we do a complete exploratory. Now, we've done a CT scan on this dog, so complete exploratory is less of a concern. This blade is a little bit long. I'm worried about it lacerating the liver, so I'm going to leave that out. So I can see the mass on the spleen. So I'm going to go ahead and take that out first. So just grab onto that. Okay. And I'll just zoom out a little bit on the camera. See what I'm doing. So I've got the spleen off to the side here. I'm just coming along the lesser curvature of the spleen. So we just keep our splenectomy patients in 1 or 2 nights, depending on ECG. Remember that one of the big potential risks associated with the splenectomy is cardiac arrhythmias, and cardiac arrhythmias can take kind of 24 to 48 hours to develop, and if they do develop, it's very indicative of malignant disease. I'm just coming along that lesser curvature of the spleen. So BYZ 513. You're asking for literature. What specifically are you looking for? Just put some pressure on that, please. And that bleeding that I got was not from use of the LigaSure, or LigaSure, it's from actually avulsing the vessels off the spleen. Come around this side. So leaving blood in the abdomen, I tend to suction out blood that I find in the abdomen. I'm not sure that whether or not it resorbs. I'm not sure that, well, red blood cells could resorb through the peritoneal lining. It doesn't make sense given their size. From the same company, I also got an ultrasonic scalpel, which I have not tried yet.
Ultrasonic scalpel. In lieu of cautery?
No, it's in lieu of a LigaSure.
Right, okay.
It just does vessels up to 5 millimeters in diameter, rather than 7 that you can get with LigaSure.
What's the advantage of?
A lot cheaper.
Yeah.
It doesn't cause any thermal damage,
Yeah.
in contrast to LigaSure, which can raise the temperature up to like 400 degrees.
Yeah. And it's like the machine and all smaller.
That's it on top there.
Yeah, okay.
Yeah, smaller machine. It doesn't do electrocautery,
Yeah.
but you can kind of, with the scalpel attachment, you can kind of dissect with it as well.
Yeah, okay.
I used one a long, long time ago. Haven't used it recently.
Yeah.
Okay, so let's see what's happening there with our little bleeders. That's our spleen here, and that's the mass right there. Again, that bleeder was not an issue with the LigaSure. It was just with me avulsing the vessels off the spleen. So there's a comment that the golden that they did was only 6-month-old and had mets to the liver, hemangiosarcoma confirmed. That's really awful. Young dogs tend to get really nasty cancers. Okay, so now we'll do our exploratory. So I always do a systematic approach, and so I'm looking down at my diaphragm, make sure there's no evidence of any diaphragmatic hernias or portosystemic shunts. Then I look at the liver. Liver looks good. Then I squeeze the gallbladder. The gallbladder is expressing easily. I'm going to palpate the stomach, make sure there aren't any foreign bodies or masses. Coming around the antrum, feel a little bit of food in the stomach. Then I'm going to do a duodenal basket. If I can find the duodenum, sitting right there. So I'll just tuck all my guts up behind the mesoduodenum. We can see the pancreas there. looking down in the hole, I can see the kidney. I don't know if you guys can see that. I can see the kidney, and I can palpate the adrenal gland. Then I'm going to come around the caudal duodenal flexure. Once I get past the caudal duodenal flexure, I will be in the jejunum, and then we'll run the whole jejunum. While we have the jejunum out, we look at the mesenteric lymph nodes. So the mesenteric lymph nodes are fine. I want to make sure that I don't create a torsion. So that all looks pretty normal. Okay, so that's the anti-mesenteric vessel right there that tells us that we're in the ileum. And then the cecum. And we've got the colon here. Then we use a colonic basket to look down at our left adrenal gland, which is sitting right there. I'm sorry, you guys probably can't see it. Left kidney. And palpate the rest of the colon. And I'm sticking my hand down here to feel prostate, but it's a neutered male, and so I can't find any prostate. And that's pretty much it. Can I get some, what's the biggest suture we've got in here? Yeah, OPDS is great, thank you. Thank you. I'm going to make sure that I get the linea. It's going all the way back. Getting the linea on both sides. Can you lift up on that, please, for me? So there's a question about reinfusing hemoabdomen. I've never done it for hemangiosarcoma. You can get a cell separator and do it, and I think it has been done with hemangiosarcoma. I guess I would be concerned about the potential for spreading cancer cells, but clinically, that is something that has been done. Question about doing an internship here. The only issue with doing an internship here in Australia is that you have to be licensed in Australia, and in order to be licensed in Australia, you have to have gone to a vet school, either in the US, Canada, the UK, Pretoria, South Africa. There's 1 or 2 schools in the Netherlands, or Australia, New Zealand. If you haven't done your vet school in one of those countries, then you can't get licensed in Australia easily. And so what you'd have to do is you'd have to come to Australia, get a vet to sponsor you, get your license, which takes a couple of years, then apply for an internship, again with unfortunately no guarantee that you get the internship, depending on what we have available at the time and how many applicants that we have and stuff. So if somebody was interested in coming here and just observing for 2 weeks or something, then that's definitely possible, and there are lots of people that do that. We have several visitors from India, from Europe, Canada, Pakistan, Dubai, who have come and spent a couple of weeks here. I always do just a simple continuous in the abdomen as long as I'm happy with my knots. Now, post-operatively, we're going to manage this guy for pain with probably methadone, paracetamol, maybe meloxicam as well. And we've done a line block on the skin to help provide some pain relief. I think we'll do a fentanyl patch as well. And we're going to monitor the ECG in hospital. Can I get some more OPDS?
Yes.
So just making sure that I'm doing very secure knots, and I'm going to do 5 to 7 throws. Because often suture or incisions that have dehiscence, it's because of the knot coming undone rather than the suture breaking. So I never do partial splenectomies. I'm always doing a complete splenectomy, just because of the potential for bleeding. Internship in Australia, well, most internships are about a year. And then people that want to specialize often end up doing a surgical internship, which is another year, and then apply for residencies. And I might have missed some questions from before, but they've moved off the screen, and so I will, when I'm finished, go back and look and make sure that there aren't any questions that I've not answered. This is just a sub-Q layer. I'm also using OPDS for this, and then I'll come back and do an intradermal. I don't have any more surgeries planned today. I've just got a CT scan for a dog that has an adrenal tumor, probably a pheochromocytoma, that we'll plan on doing surgery later on, depending on when we can get an anesthetist in. Can I please get some 2.0 something on a cutter? What do we have?
Not on a cutter here.
I can use 2.0 PDS on a taper, that's fine. Thank you. So I'm not coming to ACVS this year. I've already gone to ECVS. And regarding coming here for those types of cases, Umar, we'd be happy to have you, but I don't do a lot of lung and heart surgery here. I used to do a lot more than I do, but our caseload is, of those types of things, is quite low. So you might be better off going to, Colorado State University or something like that. Question about the speed of linea closure and if there's an invention. They actually do make linea staples for humans, which are very quick. I don't know how often they're actually used. They're great big staples. I've used them once or twice. Let's get a swab, please.
Yep.
So there are other hospitals now in town that have criticalists, as in critical care specialists, and anesthetists on site and stuff, and so they probably are doing a lot more of those lung and heart surgeries. Thank you. So regarding, say, when you do an internship here, like it's actually a paid internship, you get paid a living wage. To come and visit for 2 weeks, it doesn't cost anything, like we don't charge for that here. All right, I'm just gonna go and check the screen and see if there are questions that I haven't answered. So salary for the internship, yeah. So you get paid if you do the year-long surgery internship here, or general internship. So yeah, Z-plasties, I love them too. No more surgeries. Just looking through the questions. I think I've answered everything. So if you haven't already done so, please subscribe to our channel. Make sure you turn on notifications so you'll get a ding on your phone the next time we live stream. And we will